Welcome to our final evening of, you got it, 30 Days to Natural Diabetes and High Blood Pressure Control. I'm Dr. David DeRose. It's great to have you joining us wherever you're at in the country or the world, and it's great to have you right here in Fort Wayne, Indiana, for the final live session as we've been walking through a 30-day virtual lifestyle change program. Tonight's title is For the Long Haul. And I can just imagine people when they see that headline, for the long haul, they say, wait a minute, for the long haul, I thought we were doing a 30-day program. Well, there's no question. A 30-day program can be powerful in and of itself. And you don't have to continue everything you've been doing for 30 days. That was the deal, right? That we're going to take a concentrated approach for 30 days and see what we could accomplish as far as our diabetes, as far as our high blood pressure, as far as our attempts at losing weight. You got the picture, right? But there's a problem. If we just go right back to exactly where we were before, it's not likely that we're going to maintain any benefits that we reaped over the last 30 days. That's pretty obvious, isn't it? So having said that, I've got to tell you two stories. And I've had the privilege over the years of actually working with residential lifestyle change programs. Programs just like we've been doing here virtually and in person on an outpatient basis. I've had the privilege of working with people in inpatient settings. And I want to tell you two stories. First guy we'll call Ralph. Ralph came to our program, 30-day, no, it was only a 19-day program. Comes to a 19-day residential program. And he tells us at the very end of the program that actually he really had no intention of making big lifestyle changes that he was going to stick with. But here's what he said. After he compared his blood work at the beginning of the program with his blood work at the end, and he looked at the other things he had reaped during those 18 or 19 days together, he said, I would be a fool to go back to my old lifestyle. So here's the first thing I want you to think about. Some of you, even just over these first 3 weeks of the program, you've already seen some remarkable progress. And if you're thinking, boy, I want to continue this to continue to get these benefits, you are perfectly welcome to do that, okay? I just want to clear the air. You don't have to go back to your old lifestyle. But I've got to tell you about another fellow. We'll call him Rico. Rico also came to that very same lifestyle program. It was a different time. They weren't coming through at the same time. And Rico comes into that program, and he's got a goal. His triglycerides were sky high. And he was going to get on a lifestyle program, and he was going to get those triglycerides down in just a few weeks. Well, his triglycerides actually went up during the program. I wasn't his doctor, but his doctor sat him down before he stormed out of the facility feeling like he had wasted all his money and his time. His doctor encouraged him to stick with the program, even though he hadn't seen any changes in a few weeks, to stick with it. Do you know what happened to Rico? He got his triglycerides down remarkably by sticking with the program. So what's the message? The message is some people respond very quickly to these kind of changes. They say, that was great. I got my blood pressure down 40 points. I lost 12 pounds. My diabetes is under control. Hey, I could do this anytime. Let's enjoy the holidays. Let's forget about healthy living. And come January 1, I could just do it all over again. Well, yeah, you could do that. But really, the most powerful changes are changes that you stick with. So what I'm wanting you to really grasp in this last session that we've got together, this last live session, is think in terms of what's going to be different from here on out. Remember, yes, 30-day program, you're not constrained to do everything you've been doing for the last 3 weeks. And the end of the program, the last month that you've done. But I want to really encourage you to make lasting changes, at least in some areas. Well, having said all that, if you're keeping up with the daily videos, today is day 21 in the program, and today's video, short video, I think it was about 5.5 minutes, was entitled Be Humble. And one of the things I encouraged you with is to be humble enough to listen to your teacher. I'm in the role of a teacher, okay? I'm not in the role of a clinician. I'm not treating any one of you. You've understood that from the beginning, right? And the idea was, on this day, I wanted you looking back over the last 3 weeks saying, have I really been bold enough when it came to everything? All the challenges. Some of you heard about that exercise challenge to move more, and you say, well, I am, walking a half block. I used to just walk to the mailbox. I thought that was pretty bold. Well, I'm saying, are you humble enough to listen to your teacher? Can you be bolder the last 8 or 10 days of the program? Could you actually ramp it up to a whole block of exercise? Now, some of you think I'm putting the bar down pretty low, but just realize we're all at different points in this. So I don't know what being bold is for you, but I really want to challenge you again today to be bold. Now, some of you said, wow, one of the things was just bold to even think about eating beans. Remember, we challenged you to try to include beans every day. And you say, whoa, that was a challenge. And maybe you're not quite there yet. So I want to let you know, I've been so thankful that Judy Mueller has shared many practical recipes with us. And again, in your handouts, you have got some recipes, some additional ways to use beans. And I was really surprised by some of them. If you're looking there, those of you who are here in person, you got that in your handout physically. I've got a copy right here myself, so let me just grab that and see if I can grab it without throwing all my books on the floor. And some of you, actually, before we even started, as we were off air, you were saying, hey, that phytochemical-rich soup looks good. I think Judy actually had another name for it. And you say, yeah, that needs another name. So my apologies to Judy. And that's what happens when you're the editor, like I am. Sometimes you take editorial license inappropriately. So if you don't see any more recipes from Judy, you'll know what happened. Then the next one was for bean flour. Now that's something, I don't know if my wife has heard of this. I haven't really seen it. I haven't seen her using bean flour. So that looks really interesting. And it shows you how you can make a 3-minute creamy soup. I can handle that. I don't spend a lot of time in the kitchen, but I have mastered toasting bread and several other important tasks. So if some of you are equally challenged, you might want to learn how to make the bean flour so you can do that 3-minute creamy soup. So check out those recipes. We're just trying to encourage you, again, be humble enough to say, hey, maybe I should listen a little bit more to our teacher. Well, we want to continue to remind you how you can get all these resources. I know we've got new people joining us every week, and if you haven't been to the landing page, this is the key place to go. It's simply fortwayneadventist.org/30days. fortwayneadventist.org/30 days. If you go there, you'll find all the resources that we've covered. You'll find all the handouts. You'll find links to all the weekly videos, including today's. And so as you go down through all the resources there, you'll see the daily videos. And if you scroll past that, you'll come to each of the 4 sessions. This is number 4, our final session together. Now, I know some of you are thinking something. You're likely thinking it because it's been running through my mind multiple times. And that is, well, wait, it's a 30-day program. How come this is day 21 and we're having our last session? Because I've been trying to give you some extra support as you've been going through the program. I mean, let's face it, we could have gotten together on day 28, but by that point, it wasn't really support that you needed because the program's essentially over, right? Just a couple days. So I was trying to give you some help as you're going through the program. Now, the reality is, we have people contacting us. They're just jumping on the program. And by the way, you can point people to this website. They can start the 30-day program anytime. But we wanted to answer your questions in real time, and that's why we've been doing these live sessions. So feel free to go to that landing page, fortwayneadventist.org. Go down to section 4 if you want the handouts for tonight. You'll see that first participant handout. That's what appears on the far left. That's the outline that we're walking through. You'll see a special handout then that we call Fasting as a Natural Remedy. We'll be talking about that in a few minutes. And then you'll see the resource that I've just been referring to, More Bean Options, the recipes. So all 4 of the sessions, recipes, handouts, outline, those are all there for you. So if you want to, grab another friend and say, come January 1, I want to do this program again, you can just go there right to that same landing page and use the resources. So I'm trying to challenge you tonight. Are you being bold enough? And some of you feel like you've become friends with Sheila Adams, even if you had never met her before. Sheila was with us in our very first program, joined me our second week, and we haven't heard from her in a couple weeks. Some of you might be wondering, did I not have her on last week because she threw in the towel on the program and we'll never see her again? Well, good news is Sheila's here tonight. Sheila, why don't you come on up? And you have been doing some very exciting stuff, I know, because she shared a link with me recently. And I'm going to just tell you what I did, Sheila. The minute you sent me, not the minute you sent it to me, but I jumped on the journey. Now, there's some interesting numbers after this. We're not going to ask you whether this is your social security number or your mother's phone number, but 1-841-341-14.wordpress.com. Is that really the easiest way to get there?
That's the link to the page.
Okay, that's the link to the page. So I jumped on there, and I was excited. Well, you tell us what's up there.
Well, it's just my journey since I began the program, from the beginning when I started a year ago to where we are now.
Okay.
So it's going to give you a little explanation and a little history, a little background about me, and then it's going to take you day by day through each one of the journeys that you assigned us.
Okay, and what I gathered is you're kind of blogging as you go through the program this time around. Is that
Yes.
right? So this is day 15 that's illustrated here. These are some of the graphics from your page. I was intrigued why you had these meal plans and cookbooks illustrated for day 15 on Trim Down.
Well, it was important for me to have a plan. I've been doing this with my physician because I have arthritis and I have high blood pressure. And it was always to have a plan in place to make sure that when I lose weight and when the blood pressure goes down, the doctor can reduce the dosage.
Excellent, excellent. And I'm glad you caught that message. It's so important. So many people don't realize how powerful lifestyle change is. If you're making dramatic lifestyle changes, you've got to be monitoring your blood pressure, your blood sugar, especially if you're taking medicines for those things, because you are going to need to have those tapered down. And that indeed has happened for you, right?
Yes, it has. She's tapering me. She's starting to taper me, but not too fast because I had issues after I came off of the arthritis medicine, which raised my blood pressure because of the pain. Mm-hmm. But I have good news. It's starting to go down and the pain is starting to get under control. Good,
good. Well, so this is exciting. I was really enthused about one of the days on there, and this was day 17. We actually put it here. I know it might be hard for everyone to read, but you're talking here on day 17 where we talk about avoiding hidden sugars, about your own journey about that. Do you want to tell us a little bit about that, or am I putting you too much on the spot?
No, it's just I found out there's a lot of hidden sugars in products that you purchase from the store. And I started reading the labels, you know, the informational and nutritional labels on your packaging. And I mean, on things that I had no idea that was sugar in it. I had to start really focusing more toward not using too many processed products and start going into more natural.
This is great. So if someone wants to kind of share your journey with you, they can jump onto this website, thejourney, 1-841-341-14.wordpress.com, right?
That's correct.
And you've got a place with every day where they can interact with you.
Yes.
And this is brand new. Am I understanding that right?
It is.
So you haven't had thousands of people yet engaging with you?
No, I just had one person today before I got here. I was walking out the door when I got a ping on my phone letting me know that somebody was on the site and liked the post. And then I got another email saying someone wanted to talk to me about some stuff.
Oh, that is great. So can I tell you why I'm excited about this?
Sure.
Not only is it chronicling someone's real life journey, but I can see other people, Sheila, wanting to do this program in a month or 2 months or 3. And this is a great resource because they may say, well, I don't want to just do this on my own. They may want to connect with you. Are you okay with people doing that?
I'm fine. Just jump on there. There's a spot in there where you can send me an email on the home page, and it'll come right to my phone, and then I can contact you at any point in time.
This is great. So here's the message for you. If any of you are just starting on the program, maybe you're not on day 21, and you've never gotten connected with a partner, someone to go through this program with you, Sheila is basically making herself available. Now, if you get maybe 10,000 people, you may not be able to keep up. Is that possible?
That's possible.
Okay, fair enough. Anyway, any final comments, any words of encouragement for those who are maybe just starting or have been kind of sporadic with going through the daily challenges?
Just follow the plan. Dr. DeRose has put it in place for a reason, and if you follow it, you will be successful.
Okay.
That's what I got.
Did we pay you anything to say that?
No, you didn't pay me anything.
Okay.
I'm living proof that it's working. Even in this 30 days, I have lost weight. So
Excellent.
the program works.
Thanks for sharing your story, Sheila.
You're welcome.
Okay. It is exciting to hear from people the progress they're making, and it's been great to see Sheila kind of re-engaging with the program and being willing to share her story. So all of you, as you implement these things in your life, you become agents of change as well. Let's go to this other resource we've got for you. And the reason I put it in there is tomorrow's daily challenge is going to have to do with eat fast. Now, I know a lot of people, when they hear a doctor say eat fast, they get concerned. They think, are you telling me to go to the fast food restaurant? Are you telling me to see how quickly I can ingest my food? Well, I don't want to disappoint you, but I think somewhere along in grade school they told you about the power of a comma. The emphasis is not to eat fast, but it's to eat fast. Eat and fast, okay? So we're talking about the value of fasting in tomorrow's daily challenge. And I want to give you some additional information because I find this is one of the topics that really engages people. Actually, not all that long ago, there was a physician in another state who contacted me doing some training with other people that are interested in health coaching and helping people in their community with their health. And they said, could you give us a lecture on fasting? Actually, I spent several hours with these folks, virtual session. And these are some of the things we walk through. We walk through the power of fasting when it comes to a host of conditions. And you'll notice the top 2 on this list that I have for you are the 2 that we've been focusing on, right? Diabetes and high blood pressure. Now, there's other conditions too that can be helped by fasting. Inflammatory conditions, autoimmune diseases, now this was kind of a surprising one to me. Some years ago when I was working in one of these residential lifestyle change programs, we were putting a lot of our patients with diabetes and high blood pressure on fasts. Several days, it would be pretty much a total fast, just a water-only fast. We had checked their blood work, we were monitoring them, so it's a little bit different than people just doing it on their own. We'll talk about that in a few minutes. But these folks would come in, and they were getting, exciting things were happening. And we started to notice that other people who didn't have high blood pressure or diabetes or autoimmune diseases, maybe they were just overweight. They said, well, we want to go on a fast too. We want to fast for 3 days. And at first, I was kind of thinking, well, I don't know that that's the best, but I realized something very interesting as we started working with a variety of people. There's some kind of deeply held belief that many people have that if they miss a meal or don't eat enough, they're going to die. Now, I know some of you are smiling and you're laughing, you're saying, oh, come on now. I'm exaggerating a bit. But the point is, a lot of people think they just got to get all these calories in at every meal or something terrible is going to happen. And we found in working with people with binge eating issues and overweight, many of them, if they saw that they could survive for 3 days without eating anything, it was transformative for them. They said, like, what? I can miss a meal, or miss 2 meals? Now, for those of you that, are 6 foot tall and weigh 110 pounds, we don't want you to get real excited about fasting, okay? And I am a pretty good judge of weight. I realize there's no one with those measurements here tonight. But you understand my point, right? Okay, well, let's talk about some of the different types of fasts. Your handout goes through a number of these, what have I got here, enumerated, maybe 8 different types of fasts. We're not going to go through all of them. The handout is free. It's online. You can just download that if you're joining us virtually. If you're here, you've got all the material. I'm not going to touch on every single slide that I put in your hands, but I wanted to talk about some of these powerful concepts. And the first one, it's a type of fast just to eat less. Now, a lot of people say, well, that's not a fast, but just eating less on a regular basis is a type of fasting. And I want to put it in the context of one of the most fascinating brain chemicals that I've had the privilege to study. It is a chemical that can actually help protect you from some of the most devastating neurological diseases. This compound actually has been documented to do a number of things. It can help improve the mental processing of healthy, normal people. It's called brain-derived neurotrophic factor. How many of you have heard of BDNF? Okay, see a show of hands here? See most people just kind of shaking their heads no, or kind of thinking, is this a joke? Am I trying to have you put up your hands and I'll just say I made it up? No, it's a real compound. Brain-derived. It's actually made by your brain, and it's a neurotrophic factor. Neuro refers to nerves, brain cells, nerves, and it is a trophic factor. Trophic means a growth factor. So this is a compound that helps nerve cells, brain cells to grow and to thrive. So BDNF has a number of benefits. Like I said, it's been shown to improve cognitive functioning. It actually can aid or help prevent alcohol abuse. It has appetite suppressant effects, so if you have challenges overeating, if you can boost your levels of BDNF, it can help you in that regard. BDNF, though, has some other very impressive things in its list of benefits. It has been shown to help decrease the risk of Alzheimer's disease. It can help you lower your risk of Parkinson's disease. It can decrease the risk of one of the major causes of stroke that's called an ischemic or thrombotic stroke. And it can also help with depression. So I think at this point, even if you never heard it before, I think you should say if someone was offering, a magic wand that they could wave over you and it would raise your BDNF levels, what should you do? Well, you say there's no such thing. But you understand my point. If you could raise your BDNF levels, you would want to do that, right? That's really desirable. So let's talk, since there are no such magic wands, there's no commercially available drugs that I know of that are targeting this compound, how can you naturally raise levels of BDNF? And the first one relates to this type of fasting we're talking about, and that is dietary restriction. There's some other things that we've been talking about in this program that raise BDNF levels: regular physical exercise, environmental enrichment or stimulation. And since we're not going through this in detail in this presentation, I've given lectures on this compound in more detail in other settings, but let me just pause on this one. What you're doing today in this session is environmentally stimulating. You're hearing new material. Some of you have come to a place that maybe not a regular venue for you to hang out in. Others of you are stepping out of your comfort zone, coming to this virtual environment, going on this 30-day program. Anytime you do something new, and especially if it's more challenging, this is environmentally enriching and stimulating, and this is actually good for your brain. It helps you make more of this BDNF. And then the last thing here is alcohol avoidance. I'm going to touch on the first one and the last one because they relate to fasting in different ways. So if you're interested in more on this, some of you, I think, may have seen my Brain Health Revolution. It's a 2-hour series on DVD. You can get that on our compasshealth.net website. And when you're looking at resources, things that you can do to follow up the program, this may be one thing that you want to include on your list. Let's talk about dietary restriction now. How many of you think this looks like a good breakfast? I mean, it's definitely dietary restriction. I mean, you're not going to get too many calories from, maybe 30 Cheerios, a few pieces of apple, a couple strawberries, and some almonds. You might say, well, they're pretty good choices, even if one is a processed food. But this is not what we're talking about. We're not talking about you scaling your meals back this far, at least not for all of them. But it's really interesting if you look at research on caloric restriction, either periodic fasting or just decreased caloric intake in general can work dramatically to raise BDNF levels. So brain-derived neurotrophic factor rises when you're dietarily restricted. You say, why is that? It's very interesting. The things that tend to raise BDNF are things that mildly stress your brain. Now, this is a pretty interesting concept because most people, when they hear the word stress, what do they think? Negative. Yeah, negative, right? If I say, hey, come out next week and we're going to stress all of you. Anyone who comes, we're going to stress you. You're going to say, forget it. But you know what I've noticed? There's thousands, millions of people that are paying money. In fact, my youngest boy, his girlfriend is a personal trainer. They pay her money to stress them several times a week. Yeah, she's stressing them. They're getting on that equipment. They're lifting weights, whatever she's got them doing. And why are they doing it? Because they want to strengthen themselves, right? They want to improve their performance. The brain works the same way. So most of us don't want to sign up for stressors, but stressors in judicious amounts are actually beneficial. So remind yourself of that the next time you feel like you're being stressed. But one of the ways we stress the brain is by caloric restriction. So you say, but I'm really hungry right now, and it's only 9 o'clock at night. By the way, this is not the best time to eat. So you'd be best to let your brain get some stress. You say, but I won't be able to sleep well if I don't have that evening snack. I understand. I was there once in my life. I used to not be able to go to bed without eating some kind of sweet food before I went to bed. But your brain can readjust. Give it some stress. Raise your BDNF levels. And it doesn't take that much caloric restriction to get a benefit. As little as 30% decrease in calories significantly boosts BDNF levels. So more good news about eating less. Not only does it raise this particular compound, if you look at the research, one of the most consistent longevity-stimulating things you can do is cut back on calories. Let me give you an example. So you take an animal, let's say a rat. Let's say you have some pet rats. And one rat, you give 20% less calories than the other one would freely choose. How much longer will the calorically restricted rat live? Do any of you know? If you're cutting its calories back 20%. It will live about 20% longer. If you cut its calories back 30%, how much longer will it live? About 30%. If you cut its calories back 99%, how much longer will it live? No, you're right. It'll die of starvation, okay, before the other one. So, yeah, there's a point of diminishing returns. But the point is simply this. It's almost as if we have the ability to process so many calories in our lifespan, and then that's it. Now, of course, there's many other factors. But in general, being able to process more calories. Some people say, I'm so jealous of that person. I mean, they just sit down and they eat like 10,000 calories and they don't gain a pound. And I just look at food and I gain weight. Well, actually, the person who's eating all those calories may not be all that much better off because overeating is stressful to the system, overly stressful, and not beneficially stressful. Okay? So if you want to have the best blood fluidity, the lowest markers of inflammation, you want to be sensitive to caloric restriction. You want to find ways to do it. It will help you with arthritis. That's what the research indicates. There's a whole host of inflammatory compounds that decrease when you go on caloric restriction. One of the things we used to do in residential programs is we would put our arthritic patients, I'm thinking of a woman right now who came in with rheumatoid arthritis, and we put her on a fasting regimen, and she had sky-high markers of inflammation. One of the markers that we were measuring at that time was something called a sedimentation rate. And most of you in this room, your sedimentation rate is probably around 10. Hers was 100. Okay, so there's a lot of inflammation in her body. And within a week on this fasting regimen, she was down to 30, feeling dramatically better. So these are some of the compounds that as you fast, they decrease. Now, if you say, I never heard of tumor necrosis factor alpha. I mean, where did you come up with this? If you've seen any of these commercials for these, multi-$1,000-a-year drugs that are being used for autoimmune diseases and psoriasis and, lupus and inflammatory bowel disease, they're often working on compounds like tumor necrosis factors or interleukins. So you can impact these things. Actually, I was going to say for pennies on the dollar, but how much does it cost you to skip a meal? You actually save money, right? I mean, isn't that how it works? So you can see why this is not really the most popular topic. Doctors can't sell you sure, they could sell you supplements or something on a fast, but no one's getting rich helping people fast more, at least not on an outpatient basis. I've got some other slides in here that point out that another thing that's been shown with caloric restriction is decreasing the risk of Alzheimer's in two critical food groups, especially saturated fat. Saturated fat is especially detrimental to the brain, to the tissues. It makes the tissues more rigid. We've talked some about this, makes insulin resistance worse. And so if you want to have the best blood pressure, you want to have the best brain function, you want to avoid the saturated fats, and those primarily come to us in the form of animal fats. So leave the butter and the ice cream and those things out. That doesn't mean you could never eat them, but less is better when it comes to these dynamics. You say, okay, well, that settles it. I'm just going to go with the tofu ice cream, no saturated fat, and well, the problem is carbohydrates themselves in excess are also not beneficial. So you can't just say, anything with sugar in it is good. That's why we said, and that's why we had Sheila up here. Day 17 was what? Avoid hidden sugars, because sugars are also an enemy as far as optimal physiologic functioning. Now again, remember, you're setting the limits. We're trying to get you to move in the right direction. We're not saying you get rid of all sugar and get rid of all fat. I mean, you die, okay? Because there's simple sugars and all kinds of good things, all kinds of fruits and things like that. We're not saying you can't have anything that's sweet. We're not saying a zero-carb diet. In fact, I will tell you, if you totally leave carbs out of the equation, you're going to get into trouble. We'll come to that in a minute. Let me share this with you. I never had the privilege of meeting this couple in the circus. I heard there were many of them. They would have somebody, they often called him Tiny Tim and Big Bertha or something like that. These are two actual individuals. You can see quite the contrast, right? And you say, well, why do people have challenges with weight gain and what can help them lose weight? I wanted to give you one pointer. Some years ago, I was heading up a large hospital system's weight loss program. I was the medical director for their weight loss program. And this, to me, was one of the most powerful principles that we shared with our participants. It was this idea of eating to satisfy hunger, not eating to try to satisfy appetite. And if you've never heard this concept before, like most people, you say, what is this guy talking about? What is all this? What's the difference? Hunger is a true physiologic need for calories that your brain is perceiving, okay? So your brain is saying, I need calories, and there's an absolute need for that. That is what hunger is. It's your body telling you you need to eat. Well, you say, what's appetite then? Well, appetite is a desire for food, and it may or may not be in keeping with your hunger. So you say, well, how do I know which one it is, right? How could you tell? Because let's face it, if you go for a fast for 24 hours, when it comes the next morning after fasting for 24 hours, I can pretty much guarantee you that most people are going to be hungry and they're going to have a good appetite, right? So there's nothing wrong with having a good appetite. In fact, if you don't have an appetite at all, this is bad. Sometimes people lose their appetite in certain medical cases. I was dealing with a patient this week who had no appetite. We were talking about, he was dealing with depression and some other things, and we were talking about some things that might help him because he's losing lots of weight. So here's some things that can help you. If you want to know whether it's hunger or appetite, first of all, slow your eating down. Take time to chew your food thoroughly, okay? One of the other techniques, put your fork or your spoon down between bites. Here's another principle. If you've got a question whether it's hunger or appetite, just stop eating. Say, well, wait a minute, wait, what if it's hunger? If it's hunger, what's going to happen? Well, you know what? There'll be another meal come along, whenever you next eat. Try not to eat between meals, regular meal times. If you've got a question, stop eating. We recommend 2 or at most 3 meals a day, and we'll touch on that in just a few minutes. Now, for the less brave, I talk about something that I call the substitution test, and it works this way. If you're hungry, you'll eat anything that's acceptable, okay? If it's appetite specifically calls for certain foods. So if you just sat down to eat and you said, boy, I'm still hungry, I'd really like another piece of that chocolate pie. You say, well, if you're really hungry, do you like a green salad? Yeah, I like a green salad. Well, you'd be happy with the green salad. No, I'm not hungry for the green salad. I'm hungry for the chocolate pie. Well, if that's all that you want, it's likely appetite. If you say, well, if I really can't have the chocolate pie, I'm hungry enough, I'm going to have another salad, then okay, maybe it's okay to have the extra piece of pie. But just be careful about that too. I'm assuming that you're making these with healthy ingredients and watching out for hidden sugar. Let me tell you just a little bit about alcohol avoidance, because this is something that would be wise to totally fast from, to totally leave it off. And from the theme of neurotrophic factors, there's not just BDNF, there's other brain growth factors. Alcohol is not good when it comes to these neurotrophins. Alcohol is bad for your brain. Long-term studies show that people that even are social drinkers have poorer cognitive performance. And this has been shown in animal models as well. You upset these good compounds in the brain when you use alcoholic beverages. And let me just highlight a couple things that are on this slide. Not only is a certain neurotrophic factor called NGF, nerve growth factor, that is depressed by alcohol. But alcohol does something very interesting in the hippocampus. The hippocampus, I know it may sound like a funny name, but it's one of the very important regions in the brain for memory. And if you alter BDNF levels in this area, you're going to have more challenges with memory. And you say, well, this maybe is kind of obvious because you often notice there's this connection between alcohol and impaired mentation, right? Especially memory. Okay, there's a lot more in the handout. I don't want to spend too much more time with this because I know you've got a number of questions, but you can take a look at this list. There's those resources there in the handout. I'd encourage you to find some way, as I'll challenge you to do this tomorrow in the daily challenge, that 6-minute or so video, to eat, yes, but also to fast. Find some ways that you can incorporate fasting into your program if you haven't already. We're going to go to the questions. I know we've had a number of them coming in. And what have we got on our list tonight?
Well, we have 2 concerning thyroids. And the first one is from Tennessee. And they're asking that, is there any way to, I'm going to start in the middle of this, that they eat 3 times a day, and they're trying to figure out, are there any foods that they can eat that will help decrease the thyroid for a hypothyroid activity through this diet plan?
Okay, so I had a little bit heads up on this question. Is this the longer one on the thyroids?
This is, yes.
Okay, yeah, so Beth is trying to help you all because this is a really long question. And the basic background on this person is they had hyperthyroidism, an overactive thyroid. They were prescribed a drug called methimazole, which is a common drug that is used to treat things like Graves' disease and overactive thyroid. Sometimes when that's done, then they get hypo. So she was asking both about hypo and hyper. Let me try to make something as simple as I can. First of all, hypothyroidism, low thyroid, is actually very common. As many as 1 in 50 women, for example, throughout the course of their life will experience hypothyroidism. It's a bit less for men. We have a handout on the compasshealth.net website that goes through hypothyroidism, natural things that you can do for it. But here's what I'd like to point out. The most common cause of hypothyroidism is an autoimmune process, and it's called Hashimoto's disease. Kind of the flip side is Graves' disease. Graves' disease is an autoimmune process that activates the thyroid. Hashimoto's an autoimmune process that suppresses it. So, a couple of common denominators. Anything you can do to suppress inflammation and autoimmunity, like this type of lifestyle, we would recommend. But I also tell people to take several other steps. One of the things, there's not a lot of data on this, but some of us who are interested in more natural approaches have used this over the years. There's some suggestion that a natural compound called niacinamide may help to blunt autoimmune processes. And so a typical dose of niacinamide is 500 milligrams 3 times a day. So sometimes if someone has, we think, an autoimmune thyroid condition, either overactive or underactive, work with your doctors, yes, but look into niacinamide and talk with your healthcare provider. Say, do you see a problem with me using this? It's not niacin. Niacin can be toxic to the liver. You can have other problems with niacin. We're talking about niacinamide. It's also known as nicotinamide. So 500 milligrams 3 times a day. And this is one of the things we recommend considering. And you can look on the handout. We have a number of other things that we cover as far as thyroid. They're at my website, which is compasshealth.net. What else do we have tonight?
Okay, replacing decaffeinated coffee and teas or herbal teas they were drinking caffeinated products. Is that acceptable on the diet?
Okay. So, we're talking about this program, and we had early in the program, remember, about caffeine? Did you catch that? What was it? Cut the caffeine? Does that sound familiar? Okay. I see a few nods of recognition. That's good. And we were encouraging people to use as little caffeine as possible. So as far as that particular goal, yes, decaffeinated coffee, decaffeinated teas, those meet that criteria, okay? But I will tell you this, that coffee itself, even if it's decaffeinated, has a number of other compounds that are deleterious to the digestive tract, to the circulation. There's caffeols, there's caffeic acid, there's a number of things in there that can be problematic. There's some others that are not even coming to mind right now that I know have a role in raising homocysteine levels, which can be associated with poor blood fluidity. So here's my point. My point is, as far as this 30-day program, if you've been using a lot of caffeinated coffee and you've gone to decaf, I want to congratulate you. You have made a very powerful, positive decision. If you think, though, that that's the ideal beverage, I would say there's still things you could do, especially if you're having digestive problems and other things, circulatory issues, that might even improve on that further somewhere down the road. So just keep that in mind.
Okay, this is concerning diet. This woman has said that my question is concerning exercising and giving up sweets. She still has a problem with her stomach that you just touched on, and she is in menopause and has thyroid issues. Can you tell me what I can do that might help with those things?
Okay. So let's kind of reframe this a little bit, because here's a number of issues, number of challenges. I promised I'd talk with you about total fasts, and this is probably a good place to mention it. So you can see here listed up here, and this is in your handout, one of the last items that we have is total fasts, no caloric intake. And I want to tell you some interesting things that happen, because one of the things that upsets digestion is increased sympathetic tone. So let me just give you a brief neurophysiology lecture here. You have 2 arms to your unconscious, or we call it the autonomic nervous system. One arm we call sympathetic, the other arm we call parasympathetic. Is this sounding familiar to any of you? Maybe a few of you, maybe not. The sympathetic arm we call the fight or flight arm. This is starting to sound more familiar now, right? So that's the stress-related things, sympathetic nervous system. It's unconscious. the parasympathetic. If this is fight or flight, what is the parasympathetic associated with? This is fight or flight. This is rest and digest, okay? So if you want to have the best digestion, you don't want to ramp up the sympathetic nervous system. You want to have good parasympathetic nervous system tone. So here's something interesting. You're saying, what happens when we fast? When you fast, the sympathetic nervous system tone comes down. This contributes to lowering blood pressure, lowering blood sugar. You get rid of excess sodium from the body. If you have a tendency toward edema, it helps you get rid of excess fluid. And then insulin resistance rapidly drops. And when that happens, that further helps your blood sugar and your blood pressure and your cholesterol. Now, here's the funny thing about all this. Even though it's helping your nervous system balance, doing all these good things, if you have really bad digestive problems like reflux esophagitis, heartburn, bad heartburn, if you have bad gastritis, inflammation of the stomach, or ulcers, you can't go on a total fast. Because when you don't have that food to buffer the acid, you'll really stir things up. So you need to be on a modified fast. So it's one of the things we'd always interview people about. And I wouldn't put a person on a total fast if they had profound digestive problems that were acid related. Now, having said all this, if we're talking in this individual, exercise issues, likely diabetes, blood pressure issues, but also, thyroid, what happens if you go on a total fast? If we say, okay, we want to try to improve your digestive health overall, we think fasting 1 day a week would help with that. You don't have acid-related problems where it would be dangerous to go on a total fast, and we prescribe fasting 1 day a week, okay? It's going to be a water-only fast. I'm not prescribing this for anyone here. Really, especially if you're, again, on blood pressure or blood sugar medications, it can be dangerous to go on a total fast, especially diuretics and medicines that lower normal blood sugars. A number of the diabetes drugs like insulin and we call them the sulfonylureas like glipizide, glucotrol, things like this. These things can lower a normal blood sugar and it can be dangerous. Amaryl is another common one that some people use. Those things you got to be very careful with. So let's say you meet all those criteria. The doctor says, yeah, you'll do good with a day a week fasting. This may help to your digestion, may help your blood pressure, may help your blood sugar. But if you've got some of these other things, you've got to have input from a clinician. We want to make sure that you're not going to get into trouble when you go on a total fast. So always just remember that. So there's a lot more we could say, but again, I'd refer you to that hypothyroidism handout on compasshealth.net. There's a section for resources. You'll see free materials, and you can get that handout there. Why don't we continue?
We have two more here from our audience. One is, I have psoriatic arthritis and beginning dementia. How much should I cut back for optimum results?
Okay. So psoriatic arthritis, and what else?
Beginning dementia.
Okay, beginning dementia. So let's talk about both of those things. So psoriasis, a lot of people think, well, that's a skin disorder, and that's true. But a lot of people with psoriasis also have problems with their joints. They get actually an autoimmune arthritis called psoriatic arthritis. So this is an autoimmune arthritis, and so what we would do is one of the things that I typically do when I'm working with people in an intensive lifestyle setting is we do have them incorporate a fasting component into the regimen. This overall approach that we're using in the 30-day program tends to decrease inflammation, and that is beneficial as well, but fasting gives another dimension to that. But again, if you're going to go on one of these longer fasts, definitely get medical clearance. If someone says, hey, I'm not on any medicines, the doctor says my diabetes is diet controlled, I'm not on medicine for my blood pressure, but it's running 140/90, and the doctor says if I don't get it down, I'm going to need to. Yeah, I mean, I don't have a high degree of worry. You don't have digestive issues about you going on a 1 day water-only fast in general. Again, if you have any questions, check with your provider. But that's some things that can help with any type of autoimmune disorder. What's the other question we have?
From our audience, what is inflammation, what causes it, and can it be avoided?
Okay. So let's talk about inflammation. A lot of people, this just sounds like such a bad thing. No one usually is saying anything good about inflammation, right? But inflammation is actually something good in the right context. So it's been a while, but every now and then I'll cut myself. When you cut yourself, this is one of the things that stimulates the inflammatory response. And what's happening is you're calling white blood cells to the area. You call compounds to stop the bleeding, okay? And you notice if you've got a bad cut, it might get red around the cut. Have you noticed that? That's an inflammatory. It might swell, and then it heals. So inflammation is something useful when it's taking place in a place where you need to address a problem. Inflammation is a problem where you don't want it to be. Okay? For example, if you're smoking cigarettes, you're bringing nicotine into your system. That nicotine is damaging your blood vessel lining. And when it damages the blood vessel lining, one of the things that happens is it sets up an inflammatory process. Now, you might say, well, I don't mind a scar forming on my skin. Some of you would say, well, I could do with less scars. But the point is, you probably could handle that. But when you start to damage the inside of the lining of your blood vessels, that atherosclerosis is an inflammatory process. And so basically inflammation, think of it as involving white blood cells and compounds like histamine that's bringing fluid and swelling into an area. And if you need it in an area, it's good, like healing a wound or you've had surgery. You want the inflammatory process working for you if you break a bone. But normal circumstances, you want to keep those inflammatory processes quieter. And the way you do that is by a healthier lifestyle. Now, let me tell you something interesting. Some years ago, and I think we put this in the Methuselah Factor book, there was a doctor out at Kaiser, the Kaiser system out in California, and he published a medical article talking about this concept of inflammation and how it was involved in diabetes. And he found something very interesting. He said, years ago, I can even remember this, when I first took college nutrition, before I was, did a master's in public health or had any medical training, my earliest nutrition training was at the college level. And I can remember them telling us, well, you've got to get a complete protein. And, if you want to get a complete protein, that's like what you get when you eat meat or eggs. And even back then, I was having some questions about this. Well, here's what this researcher found. He found that when you eat this, quote, complete protein, beef tissue to your body chemically looks actually very similar to your own tissue. Okay? It's pretty similar. A lot more similar than bean protein. Would that make sense, that you would have more in common with a cow than a bean? Yeah, pretty obvious. So the amino acids, the protein building blocks, very similar relationship. And he said when you flood your system with protein building blocks that look like the relationship you have in your tissues, your body thinks that your own tissues are breaking down, and it activates an inflammatory response. Thinks, well, maybe you just had surgery. Maybe you just had an accident. And so when we flood our system with what they used to tell us, this was a number of decades ago, if you can, good judge of age, they were saying, yeah, you eat these complete proteins, that's the best for you. Now, most nutrition experts are saying that's not what you should be doing, okay? You don't want to eat those things that look like your tissues. You want to eat more of the plant proteins. That you want the bulk of your protein sources from there, and that's going to suppress inflammation. So in general, the plant sources of nutrition suppress inflammation. Animal sources raise it. It's not just the protein, it's also the saturated fat that I alluded to earlier. Is there anything else on the question list tonight?
Just about the amount of turmeric somebody might want to add to their meals.
Okay, so a question about turmeric. So we talked about a number of natural anti-inflammatory compounds. We talked about the omega-3 fats. We talked about boswellia. We talked about turmeric. Turmeric, a typical medical dosage is 500 milligrams 3 times a day. Some people with turmeric, they'll have irritation of their stomach, especially if they take it on an empty stomach, or especially if they eat much of it. So be careful with any of these supplements. Don't try to take the maximum. Start with a small amount, and don't start with a whole bunch of supplements at once. Pick one at first that you think might be beneficial for you. Start using that, and then if you tolerate that well, maybe a week or two later, if you think you want to add something else. If you add a whole bunch of supplements at once, two big problems, at least possible. One is you're going to have a reaction to something. You took this cocktail of it. This is why I don't like these multi-supplement preparations that people sell. They charge you, a high dollar for it. They say, this special doctor formulated these 15 different herbs. Well, if you have a reaction to it, you're not going to know which of those 15 herbs you had a problem with, or if it was the capsule that they put it in. And so you really got to take all those things off your list, at least for a while, and then, very perhaps gradually, if you didn't have too bad a reaction, add them back in. So I prefer to have people start with a single agent and then kind of gradually. The other problem with it is if you do take that multi-vitamin, mineral, phytochemical supplement and it helps you, you're going to say, well, what in this supplement helped me? It may have just been one ingredient that you could be paying, getting for a few cents a day, and you're paying $1 a day for this expensive supplement. So that's the other reason why I don't recommend those compounded supplements. We good for tonight?
Yes, sir.
Wow, that was good timing. Listen, as we're winding down our final evening, I want to encourage you with a few things, because some of you are saying, okay, I'm just jumping on, or I'm looking at finishing the program, I've had great results. Day 30 of the program, I'll tell you, it's actually encouraging you. Well, have any of you looked ahead? By the way, you can look on your sheet, or if you have a copy of the Methuselah Factor book, remember, the goals are similar in here. By the way, some of the stories I told you tonight actually came right out of this chapter. It's not plagiarism since I'm the author. Chapter 44, day 30, sign up for a marathon. Sign up for a marathon. Now, that doesn't mean to sign up to run a 26-mile race, 26.2 miles if you're being very precise. What it is, it's saying, we want to challenge you that once you finish this 30-day program, to plan to do something else that continues to reap the benefits. And one of the things you can do, if you've gone through this free program, consider picking up a copy of the Methuselah Factor, widely available on Amazon and other places. And what we have on special on the Compass Health website through the month of November 2021, as well as the augmented videos. So the free videos, you figured out. I was just recording those in my office. But if you want to get the professionally produced Methuselah Factor videos, so they expand each of the daily goals to deal with a host of other things beside diabetes and high blood pressure. These are also on special price. I know the digital download is half price. I think it's just less than $10 the month of November. So if you want some other resources to help you, if you want to go on another 30-day journey, invite some others to jump on with you, those resources are available. But I'll tell you, you don't have to spend a penny, because what we've got on the website is what? We've got the stuff that's going to stay up there, fortwayneadventist.org/30 days. I would encourage you, find someone else that wants to go on the program with you and say, hey, I'm going to do this again after January 1st. I don't know that I could do it right after, because a lot's coming up in November and December, but I want to go on this program. Or maybe you're part of a faith community, or your workplace. Maybe there's a group of people that eat together in your workplace, and you're kind of health conscious, and you want to improve your health. I just want to challenge you, don't look at the 30 days as, hey, I did that, I can check that off my list, and I can tell everyone there was a time in my life where I went on a 30-day lifestyle program. Okay? That is really not the goal of this. The goal is to say, what can I stick with and continue to reap those benefits? Well, I want to thank each one of you for having been a part of the program, those of you that came to our live sessions here, as well as those of you who joined us virtually. I'm just excited about what's happening in this setting and throughout the country, throughout the world. I'd love to hear from you. So jump on either to the Fort Wayne Adventist.org/30 days website, share what's going on with us, or jump on to compasshealth.net, tap into our resources, free resources there, as well as our other services. Well, all I can tell you, after this great start together, continue on the program. You've just got about 8 or 10 more days. And, well, as I sign off my weekly radio show, I'm Dr. David DeRose, wishing all of you the very best of health.